I have personal experience of using them in Hyderabad. We still continue to use them. Semaglutide with icodec. Semaglutide, of course, all of you have learned so much about semaglutide, so I'm not going to talk anything about semaglutide, but basically things have evolved a lot. I'm lucky enough to be here watching the evolution of these incretins starting from 1G, 2G to 3G. Now I'm going to talk mostly about the 3Gs or MAFLD, because today's topic is MAFLD. I'll be talking about the role of these new medicines or the existing medicines. They are not so new, existing medicines. Semaglutide is the most popular hot cake all over the world, not only in India. For a tablet 370 rupees is out of stock most of the time. In America also, Ozempic and Wegovy are out of stock in most of the places. So things have become sort of an unexpected way of looking at diabetes. People have been using Ozempic and Wegovy like anything, anywhere in the world. And it is shortage. That is the reason why Novo Nordisk is not bringing the medicines to India. It's a shortage. The medicines are in shortage. And you can see the 3G, which is coming into market maybe after 1 or 2 years, will be the real medicine for treating NAFLD or MASH. So you can see the benefits of 3G. 3G is glucagon along with the GLP and the GAP. So you all know about all these things, and semaglutide is the most widely used medicine all over the world, both in practice as well as in research. So most of the medicines which I have been using here, drugs which I am trying here, a combination with semaglutide and other semaglutide with other things. So I am not going to talk about semaglutide, but I will talk to you about other things. Tirzepatide is another medicine that is a hot cake all over the world. Monjaro is the name. For last 2-3 years, it is also getting out of stock from all over the world. That is the reason why they are not introducing to India. Now, obesity is what all of us have been thinking for last 30 years, is also changing its picture. It's not just obesity by your truncal obesity or your total obesity. It's basically your liver fat. It's not subcutaneous fat around your abdomen or total fat that matters, but liver fat that matters. That means your BMI, waist-hip ratios, and all these measurements, what you have been doing all these years, is gradually being replaced by those liver fat measurements. So these are all the medicines which you are using right now in drug trials. They're all drug trials. So this is a cagrilintide. We were using promelinitide long ago, about 30 years back in drug trials, but now cagrilintide, the weekly injection, along with semaglutide. So that's why it's called cagrisema. Cagrilintide along with semaglutide, weekly once, is the treatment for obesity or MAFLD with diabetes. And retatrutide is the 3G, that is GAP, GLP, and glucagon receptor agonist. So this is the medicine which is supposed to have largest weight loss, 17.5% mean weight loss in 3G medicines. Orforglipron is a oral GLP receptor agonist. Like your semaglutide, which has become so popular in India, semaglutide costing 370 rupees, 3 milligrams, 7 milligrams, 14 milligrams is a hot cake. It was released and within 15 days, the entire stocks were over from India. So that is a semaglutide. So other companies also bringing oral GLP receptor agonist, and we have some experience about orforglipron in some of our studies. Then coming to the liver, so PNPL3 gene is something not known to me till recently. I was asking Rakesh and other people in AAG. They said, oh, they have seen several hundred. It's already over. I think I need another 5 minutes more. PNPLP3 gene is something which is new to me. But it seems the people with the PNPL3 homozygous PNPL3 gene are supposed to be more prone for developing MASH and also liver cancers. So it seems AAG in Gachibowli, they have a few patients with the homozygous PNPL3 gene. So we have a drug, it is gene modulator. It suppresses the effect of PNPL3 gene. So this is given only once in a month, and this is supposed to be good in preventing liver cancer or preventing the cirrhosis. So that is a drug which we are trying to use now. And FGF21 agonist analog is another one. This is also from Novo Nordisk. So for this, basically it reduces the fibrosis. You know, most of these studies have to be done, or most of the drugs are given after that gold standard diagnosis of liver biopsy. That is the most expensive and difficult thing to do. It's not difficult for radiologist or for ultrasound man, but it's difficult for us to convince our patient to go for liver biopsy without any problem. Just tell them, I want to do liver biopsy. Unless we have a liver biopsy evidence for fibrosis or cirrhosis or some histopathology changes, we are not going to treat them for anything, neither endocrinologist nor gastroenterologist. So FGF21 is another. FGF21 is also given in combination with semaglutide. So semaglutide plus FGF21 is given weekly once for preventing or reducing the fibrosis in liver, that MASH or MAFLD. I will have 2 slides on saroglitazar. Saroglitazar is something very unique to us, our country. It's a make in India. We made it in India from Zydus. And Redilab also has made ragaglitazar and balaglitazar. You all know about glitazones. You know very well about glitazones. There was so much of material has been discussed about glitazones. So this has got more of lipid regulation than glitazones. So ragaglitazar was actually tried in India by Novo Nordisk. That was a product made in Hyderabad. Balaglitazar was given to Pfizer, but they have not done the clinical trials we were supposed to do. We have done clinical trials on muraglitazar, that is from UK. So glitazars are very good in reducing lipids. Somehow, in most of the discussions in India as well as abroad, they don't talk much about glitazars. But it is one of the good medicines for reducing the lipids. So starting from 2012, I have given a list of events related to saroglitazar. I was there in 2012 in NDSC, in DCJ. So saroglitazar, the problem is they are not been able to do this expensive, difficult liver biopsies to prove the diagnosis as well as reduction in the MAFLD scores. These are the scores. So that is the reason why it is not being published properly, it's not being accepted. But people have been using saroglitazar left and right in India. It's a make in India, it's not approved anywhere. I mean, Mexico, in some parts, sometimes it was accepted, but it is no more accepted. So except in India, it is not accepted anywhere, but it seems it is a good medicine for. Then the real medicine for MASH has just been approved in March this year. It's called resmetirom. It's basically an endocrine product. So you can see it's a partial activator of thyroid hormone receptor. So this is the only drug so far, actually it costs about $48,000 per year, so $4,000, and it is available now in India and some places in Europe also. So resmetirom, initially it got a fast track FDA approval, but now it has completed 52 weeks and it's a reliable test for, reliable drug for reducing the steatosis as well as fibrosis in MASH. I have a big slide, but I am skipping the slide. I have some information to tell you about that, but I think time is not there, so I am skipping the slide. Thank you. Thank you very much. Basically, These are all the clinical studies, and there are some points to be discussed, but thank you so much for giving me this opportunity.
The lucid presentation, sir.
Thank you.
From Mohsin, Dr. Mohsin, and with you, sir. And thanks for enlightening the latest drugs which are in pipeline also.
So the next speaker is Dr. Rakesh Kalapala. Dr. Rakesh, he's going to talk on endoscopic management of diabetes and NAFLD. Over to Dr. Rakesh.